if we take the example of injecting insulin, which is, I believe, a further along step of treating type 2 diabetes, that's actually masking the underlying problem and can cause more of an issue over time.
Exactly. So there's, again, you think about the two compartments, the blood glucose and the sort of body glucose, which is the storage, right? Same as you look at, sort of what's on the table and what's in the fridge, right? There's what's in front of you that you can see, and then there's what's put away. So the blood glucose is what you can see. You can measure it, you can see it, but you can't see what's stored away. You don't know how much there is. You can only measure it indirectly through the abdominal obesity. You can measure how big the liver is, that kind of thing. So for years, because the only thing we could see was the blood glucose, we thought that was the most important thing. And therefore, we should put all our emphasis on lowering this blood glucose. But there's two compartments, right? There's the blood glucose, there's the body glucose, which is the storage. So if you take that blood glucose and you simply shove it into your liver, take all that glucose, shove it into your liver, okay, what's going to happen? Well, your storage compartment is going to increase and your blood glucose is going to decrease. That's what you told the body to do. So if your storage is full, so type 2 diabetes, storage is full, it's overflowing, all this glucose is overflowing out of the body into the blood. Now you take this insulin, this drug, and remember, this is a standard medical practice practiced by every single sort of specialist in the world for the last 40 years. They say, wow, your blood glucose is too high. Your body glucose is also too high, but they're only looking at the blood glucose. So they said, we need to lower it. We can lower it by taking the blood glucose and shoving it back into your liver. It's like, okay, but you haven't fixed the problem, because the problem was that your liver was overflowing. That was the whole problem in the first place. You're basically going to make it worse, because the liver is going to take this glucose that you now shoved into the liver, turn it into fat, right? So you take insulin, you gain weight, because we know that's a main side effect of insulin, because that's what you're telling the body to do. Insulin tells your body to store more glucose. So you gain weight. As you gain weight, what happens to your type 2 diabetes? Well, it gets worse. Then you take more insulin. Then what happens? You gain more weight.